Well, sexual problems may be caused by psychological or relational issues, and then psychotherapy and counseling may be needed to resolve these underlying issues. But even when the sexual problem is caused by biomedical factors, we know that psychological mechanisms are always involved. Because sexual problems cause a lot of distress, both in the patient and in the partner. They often go along with failure anxiety and performance demand and guilt and shame and so on. And what medical treatment does is focusing on the symptoms, trying to restore the sexual function. But that's often not sufficient. Additional counseling, psychotherapy is needed to actually tackle these underlying failure anxiety, performance, distress, and so on. So we know that a combination treatment, so counseling and medical treatment, is much more effective than medical treatment alone because the problem needs to be treated as a whole, as a biopsychosocial condition, as we call it.
I think the greatest benefit is that a psychologist can help men re-engage in sexual activity. Oftentimes, if they struggle with sexual dysfunction, they become anxious and nervous about re-engaging and starting sexual activity. We have great treatments to help with sexual dysfunction on the physical side. But on the psychological side, a psychologist can really help with really concrete strategies to help men reduce anxiety and re-engage in sexual activity.
So in thinking about how patients can benefit from having a visit with a sexual psychologist, the first thing I would have to say is that every single sexual problem has a psychological component. And so you can't take that away even if they might be seeing a medical provider, for example. Sexual psychologists are people who are trained to think about the psychosocial aspect of sexual healthcare. Every part of being a sexual being is going to affect your psychology in many ways. So they have advanced training in how to kind of tease out what the most bothersome problem might be, and especially extra advanced training in thinking about tools to help people manage the significant emotional side effects that having a sexual problem gives them.